got very few subscribers and followers, but look at all these hearts. So what's going on? Okay, thank you guys. So put your questions in the comments. YouTube, I love you guys. YouTube, mic check, we're good. LinkedIn, we're good. Facebook, you guys are always sleepy. Okay, Facebook is asleep. I don't know what's going on. I should just turn off the Facebook. If you're on Facebook, let me know if you even want to see this, because this Facebook is dead. Okay, the algorithm's there. We need to do something. What's up, Myra? Okay, Instagram. I know it's the same company, but Instagram is a little more like the audience is very engaged. The hearts don't stop. Okay, and then the comments keep rolling in on Instagram, and it's like I don't even have this fancy hookup to Instagram. So I don't know what's going on, but the vlogging was really good. How to research. I got the inspiration from you. If I get triggered thumb, I'm sending you the bill. Maybe we'll do a study for triggered thumb. Too much Instagram. I'm watching too much Instagram, and I'm smashing the screen so much that maybe that's a new indication. Is it possible to move from a role in an SMO to a CRO? Of course, guys. When you ask about possibilities, okay, anything is possible. You should know this by now. It's 2021. Okay. Of course, it's possible to move from a role in an SMO to a CRO. They're very much related. Very much related. Dan, are they doing any conferences lately for research? All the conferences are virtual. I don't know. If you know of a conference that's not going to be virtual, first of all, that's pretty gutsy. All right. Second of all, let me know, because I don't know. All the conferences I'm aware of are virtual. And guess what? I'm not interested in attending virtual conferences, because when I go to conferences, the value I get is not in sitting there listening to some speaker talk. They're usually boring. They usually have an agenda, and they're usually there to sell you something. Okay. I like to walk the exhibit halls, talk to all the people at the booths, make real business happen. I'm not interested in listening to somebody talk. I mean, I'm just not. Like, what are they going to say? Virtual trials? What do we? I can tell you guys about this here for free. We can do a conference every Monday, Wednesday, Friday. Okay. There's a sudden craze in starting CROs. Yes. Got my letter as an essential worker. How do we start to have a CRO? Geez, you guys love in the CRO lifestyle. You guys love it. You think you love it until you do it. Then you're not going to love it. Man, those hearts are going crazy right now on Instagram. A lot of vaccine virtual research conference. Not interested. Exactly. What's this emoji? This emoji on the iPhone. That's my virtual conference. That's my answer. Not interested. I would say put your own conference on. That'd be better. Get on Instagram Live, get on Facebook Live, Facebook's not so good, but LinkedIn, YouTube, Instagram. That's the way to go. That's exactly right. I have zero interest in virtual conferences. And guess what? They're charging money. I wouldn't even be interested if they're free. Even if it's free, I go like this. Okay. Now, if they want me to speak, okay, I changed my mind. You're gonna pay. I like your conference. Okay. Yeah. If you want to pay, I love your conference, and we're gonna talk. Any suggestions for starting a CRO? I say start a site first. The easiest way to start a site is to start, or the easiest way to start a CRO is to start a site. Okay, and then try to get into phase 1 as quickly as you can. That's also the hardest site to start. All right, so you're gonna start as a site outpatient, then you want to eventually get you into phase 1, and now you have an infrastructure to offer sponsors. And now you can tell them, hey, not only do we have the sites, but guess what? I have CRA experience. We can be a CRO as well. And this is a year that they would probably take you up on that, because there's so many studies and there's not enough budgets. I mean, like IQVIA can't do every study. Neither can PPD. Neither can Syneos. What about virtual trials? Anyone has any experience with it? Yeah, let me know what your experiences are with virtual trials. Like reality, okay? Hype or what? Because I'm monitoring 2 virtual trials, and that's good. But these are considered real studies. The only virtual aspect is that the patient doesn't come to the office, right? But there's a coordinator, there's a PI, there's monitors, there's IP, all this stuff. So They're not replacing the site. They're doing it out of necessity. Those hearts on Instagram, it just makes my Friday. Okay. After visiting Office Space, you guys are gonna see in the vlog, there was some dumps. We saw some dumps. I have not done them, but heard their pay is shit. We're family friendly, but yeah, I completely agree with you. Okay. Um, Great, thanks. I need your help later. Yeah, so anybody wants to start a CRO, that's the way to do it. Start a site. Don't start a CRO. Start a site, do phase one, then go CRO. Because what I'm going to ask you, the person who asked this, I think it was on Instagram, what is a CRO? Like, what do you offer? Are you full service? You're doing biostatistics? You're doing data management? You're doing data analysis? You're doing protocol development? You're doing regulatory affairs? What are you doing? Or you're just doing monitoring? That's what we need to know first. Are you full service? Are you a la carte? What's your therapeutic expertise? This is the question I'm asking you if I were a potential customer. Budget wise, the virtual trials I've seen for budget wise are dump. Probably dumped like the first two places I've seen. You guys are going to love the vlog. The first two places I've seen today, absolute dumped. But it had potential, but it's not going to work out for us. The last two are going to work out. Yeah. Keep the comments on Instagram and the hearts. We're confusing the algorithms, guys. They're gonna be like, how is only 8 people watching live and look at all these hearts? Something's going on. This guy's like doing something. Maybe I get banned, but no, we're gonna get more followers here, and we're gonna get more people interested in research. CROs take a large amount of resources based on all professions needed. Yes, How to Clinical Research is a great account to follow. Follow him. He also talks about stocks. We got to go live sometime. I got to interview you again. How to Research. I only did it once. I can't believe I only did it one time, and I'm about to move. And we gotta get connected again. Hi Dan, I'm an international medical graduate working as a lead CRC in medical device. Is there a lot of CRA positions in the medical device field? I interviewed for CR positions, but all of them required clinical trial experience. Yes, there are. And guess what? If you have experience with devices, you can still do investigational product. The research is the same, guys. GCP is the same. Regulatory is the same. Who do you follow? You follow right there above your comment. How to clinical research. I want you to C_Naro. I want you to. And by the way, how was your vacation in Missouri? It looked fun. I want you to click on How to Clinical Research. I want you to follow. I want you guys to connect, and I want those hearts like fluttering on this EKG style. So clinical research experience doesn't matter if it's device or IP. The monitoring is the same. There's really no difference. Matter of fact, it's easier to do IP accountability on device. Let's do it. Yes. How to Clinical Research is good guy to follow. I plan to open a site next year, and I want to do some preparatory work. I will be the owner and coordinator. Guess what? Me too. When I moved to Arizona, it's the same exact situation. Can you please suggest what certifications and trainings do I need to make most of my time? Hold on, I just skipped that comment. Time, money, and effort. I am thinking about taking pharmacy technician, phlebotomist, nursing assistant. Good point. Here's what you need: GCP. Okay, you need GCP. Another one and that's free. Another one you need is IATA. These comments are going crazy, but can you help me read? My wife's gonna help me read some. See if I missed any good ones from the beginning. I don't know if you can. What's up, Dan? Are you locked up now in Arizona? No, I'm not in Arizona yet, guys. I'm in Buena Park. Okay, looking for office space. Before I move, I gotta get one of my sites transitioned to another location. All right. Are you guys planning to launch a second book? Definitely not anytime soon, a second book. However, Monica and Judy from Latinos in Clinical Research agreed to translate the book in Spanish as part of the Latinos in Clinical Research. So the Comprehensive Guide to Clinical Research is going to be in Spanish also, thanks to those two ladies. And they're going to have an audiobook, right? And they're going to see the work we had to put in for that audiobook. That's not easy. Any questions from the beginning? Nothing? You can't scroll up?
I just joined.
I don't know if I missed anybody's, but it's okay. Keep them coming now.
Awesome news on the Spanish.
If I missed your question on Instagram, put it in there. Let me get to this guy's on YouTube right now and then on LinkedIn.
Awesome news on the Spanish, Maximus says.
Yeah, LatinosInClinicalResearch.com. Yeah, okay, good. You followed How to Clinical Research. Everybody should follow him. We gotta do another How to Clinical Research. Let me know when. All right. Like we gotta do a meetup. I know Joey wants to meet up too. Maybe we can do something in Lake Forest.
Is this Farah your wife? Yes, I am.
Yes. She's
Mississippi is beautiful here until March.
Mississippi's looked amazing. I've never been. I saw Ozark, but I think that's Missouri.
Randy has a question. Dan, I have an interview next week for a CRC in spine and pain research site, and I need to know what rating scales are. What should I prepare for?
Okay. So here's what you got to do, because I don't even know off the top of my head. You got to go to clinicaltrials.gov. Let me do it with you live. Okay. So this person has an interview for a pain and spine research center. So let's put like I don't know what's the indication. Let's just do pain. Okay.
How to Clinical Research is saying I'm free this weekend.
Are we free this weekend?
Brandy says thank you.
I have an interview in Spanish. Okay, so clinicaltrials.gov. I just put pain because I don't know. You get more specific, okay? Because the more specific, the more you're gonna get, the better answers. But here's a couple. You're gonna click on them, and you're gonna look at the primary and secondary endpoints, and you're gonna see. Usually, they have different assessments that are measuring the whatever the indication is. In your case, it's pain. So I'm here. This one is with MRIs, so this one's not a good example of a study for you. You just got to keep playing around. I'm going to find one for you. Efficacy of treatment of acute pain. Let's see what this one. This one looks like it might have something for you. You just got to go like spend some half an hour on here. Pain intensity difference. So this one is the primary outcome is time weighted sum of pain intensity difference over 6 hours. The acronym is SPID 0-6.
Brandy says it's measured in scale.
Yeah, they have scales for everything in research. Everything's measured. They should be the pain scales. I remember the pain scales from back in the days, but just go look pain on clinicaltrials.gov and you'll find.
Randy,
Okay.
can you find the company on clinicaltrials.gov? Says C. Navarro. C. Nara?
Yeah. Oh, you can even look them up on clinicaltrials.gov, the name of the company, and see what studies they're doing. Even better.
Do you have the recording of the last Latinos in Clinical Research
Yes.
Zoom meeting? Would love to check it out.
Yes. You got to go to Latinos in Clinical Research on YouTube. Go to YouTube, type Latinos in Clinical Research, and subscribe, and you'll see it right there.
Brandy says, "Okay, makes sense."
Let me get to this guy on YouTube real quick. Okay, hold on. Keep and look for the good ones when they come.
All right.
I plan to open a site next year. I want to do some work. So GCP, you do, and you're gonna be the coordinator. So somebody's gonna have to draw blood. You're right. Okay. There's no real requirements in research. Like there's no licenses you need to draw blood. Check with your state. But even in California, if it's research, if it's less than a certain amount of blood draws per month, which most research is, you just need supervision. You need some kind of safety training. I always prefer to have a medical assistant, and you can get interns to be your medical assistants for free from all the medical assistant schools. They're all looking for externships. So get GCP, get IATA, watch some. So your doctor is going to do the ECGs, not you. He's going to assess, or she's going to assess the ECGs and the vitals. So really what it is GCP, IATA, and somebody to draw blood. And then the ECG, to learn how to put the electrodes on, is so simple. They're going to give you a manual when you get the ECG, but your doctor can teach you that just once.
What do you think of trial brokers? In my opinion, they don't bring near the value they charge for, says Maximus.
Maximus is awesome. That's a great dirt biker. The Sun, yeah.
Awesome.
Study brokers are horrible. Well, some of them are okay, I guess, but the ones I've met are not so good. Okay, so that's the one for the site. LinkedIn. What's up, Michael?
How to Clinical research says you can easily piss off patients with someone who doesn't know how to draw blood.
Yeah, you can. You can. You can. Sometimes you just have a bad day too. I used to draw blood for my clinics like a lot. I might have to start doing it again when I move there, but my niece is a medical assistant. So we're going to teach her. The doctor's going to teach her. We're answering your questions, Paula. Anything you got on your mind? Do you have any book or training manual that you recommend for a new CRA? Yes, the Comprehensive Guide to Clinical Research.
Where is it?
It's on YouTube.
No, do you have one?
Oh no, actually, I gave it away from the last live stream. I gave away the Comprehensive Guide to Clinical Research.
You already
Uh,
gave me one.
huh? No, I gave it away. I gave it away.
Never gave me one.
Yeah, but you were in the dedication.
Oh, thank you.
I dedicated the book to you and my dad. Uh, so that's the book I recommend. I have an interview for site coordinator position. Any advice? Yeah, know the stuff. Like know the company. Like the person who asked on Instagram, go look up the company on clinicaltrials.gov. You'll find them.
PT Scrub says, I actually keep one in my travel bag.
Oh, the book. Thank you. PT Scrub was in our very first CRA Academy class in January 2016, or I think it was April 2016. And she's now been a CRA for I don't know how many years. She's coming to teach guest lecture to motivate. Site coordinator position. Any advice? Just like I gave Randy on Instagram.
Get GCP says,
Yeah, GCP. Just like Randy on Instagram. Okay, study the company that you're interviewing with. Know what studies they're doing. As specifically as possible. Go on clinicaltrials.gov, look them up on Google. At least know what therapeutic indications they're doing. If you don't have experience with any of those therapeutic indications, you go on clinicaltrials.gov, you put up therapeutic indications, you look at the primary endpoints, you look at the secondary endpoints, you look at some of the assessments, and you see if it's schizophrenia, you see, okay, they do positive and negative symptoms of schizophrenia, CGI, Columbia, severity, suicide scale. You got to know. If you go in and you don't know this stuff, I mean, anybody can do their homework. You don't need to be experienced to do your homework and know what a site is doing. The lighting looks perfect. Corwin, how's it going on LinkedIn? I am a data manager with more than 15 years. I plan to open a site next year. I know everything theoretically in owning a site, but would you allow people like me to do an internship at your site for 2 to 4 weeks for practical experience? Usually no, but maybe if you ask nicely, like maybe email me. Right.
Maximus Racing says, I need another CRC in Phoenix.
Hey, anybody in Phoenix who's looking for a CRC job, okay, get on Instagram. If you can't find Maximus Racing, just message me. If you're on LinkedIn, YouTube, wherever, message me. If you're in Phoenix, because we have an opening.
Thank you, he says.
Hey, Elliot, how's it going? Connor Safe. Do you ever see Pharmacist as a CRA or project manager? Yeah, I actually have. I have. Pharmacists, I've seen them as CRAs or project manager. Not that common because usually pharmacists do either like work at a site or they are like medical science liaisons in between research and development and sales, but they're still involved in research, clinical research. Yeah, Randy. Randy says, wow. Nice. Not far from Scottsdale.
Nope.
Well, I've got a question for you. How can sites encourage subjects in COVID-19 studies, considering EUA vaccines are becoming more available? How can sites encourage subjects in COVID-19 studies, considering EUA vaccines are becoming more available? Because people are afraid of the vaccine, guys. People need more. So there's COVID treatment studies, there are COVID prophylaxis studies. Those are easier to recruit for. There's mild to moderate COVID outpatient studies. Those are easier to recruit for. Of course, there's the vaccine studies. Just because the vaccine's coming out doesn't mean that that's killing COVID studies. That's going to increase COVID studies because people want to see more data on these vaccines. They want to see more long-term safety, more long-term efficacy. So you're going to have more studies. And then to encourage the subjects, I mean, I know a lot of people that don't want to take the vaccine until like next year because they want to see more long-term data. So they're going to do prophylactic studies and treatment studies if they do happen to get COVID.
He says it's been authorized safe by FDA. It
Yeah.
was on Pfizer vaccine and recruited over 300 patients.
Who?
Randy's. He says about the
Yeah, yeah. I mean, they say it's safe, but we need to do long-term efficacy, long-term safety.
Mhm.
And there's patients that there's sites that are afraid that now that the vaccine's out, that COVID studies are done. It's not the case. If I want to get a loan from the bank to open a site, how much should I ask for? Don't do it. Don't do it. I rather you go instead of going to the bank, I want you to go to a doctor's office and talk to them. And if they say no, I want you to go to another doctor's office and talk to them and another until somebody says yes, you can use my office. Give me cut me in on the deal. You be my coordinator. We'll go partners. You don't go get a loan from the bank. Don't do that.
From to Jacksonville, Florida. Shout out to Miss Farah who is reading Instagram questions. They were having nice work. Thank you, Maximus.
Thank you, Maximus. I know his real name, but I don't know if he wants me to say it.
Maximus.
This is weird to call him Maximus. Uh, okay, so yeah, no loans from the banks.
Never alone, says Randy.
Okay, thank you. People confirming. Let me know in the comments if you agree on Instagram, on Facebook, on LinkedIn, and on YouTube. Like, heart, that no loans. Loans is a easy way to say I don't want to have to go talk to doctors, so I rather talk to the bank. Makes no sense. You're gonna go in debt. What are you gonna do? You don't have a PI.
So nice to have her on live. Thank you, Gabby.
This is Lee. Of course, Lee. Lee's a Patreon VIP member. By the way, shameless plug for the
Connect
Patreon.
with Lee on LinkedIn.
Lee is on LinkedIn. Any advice how to get a shot at landing a job as a CRA when I don't have a college degree and only have work experience? Unfortunately, I don't think that's happening. For CRA, the requirement now is bachelor's, and yes, there are very rare cases where people don't have bachelor's degrees, but it's more people that have been grandfathered in. So unfortunately, maybe for a very small CRO, like
Thank
if you
you.
really have experience as a coordinator, like a lot of experience, I think a smaller CRO could hire you because you do have your experience is worth more in my opinion than your degree. Don't get me wrong, but I'm telling you how these CROs and big pharma think.
This is thank you, Miss Farah. Thank you, Randy. You're welcome.
Let's go, hearts.
Lee Eifler. Eifler?
Yeah, Lee.
On LinkedIn for Maximus. Miss Farah, do you work in research as well? I'm the what would you call me?
She's on LinkedIn.
Yeah, I'm like everything behind the
I
scenes.
think we gave her a title, something about marketing.
Yeah.
She actually found our doctor in Yuma.
Yeah.
I gotta give her props.
Recruiter.
She's mapped out 100 different doctors in Yuma. We emailed them all. We got 2 of them back. The Sonic stomach.
He's just.
Sonic needs a walk pretty soon.
I also gave you the links to the places today.
And she found the office spaces for Buena Park. So unfortunately, Lindsay, that's what I think. I agree. Your experience is more important than your degree. Just keep having that experience. You're on the right platform. You're on LinkedIn. Network with people on there. The smaller the CRO, the better. The less they care about your degrees, and the more they care about your work experience. But for the big CROs, I could almost say forget it.
Lee is saying to please also follow West Value Research on LinkedIn.
Yeah, and other people agree. Experience is worth way more than a degree, but you do need a minimum. You need a floor for that. So yeah, no loans. I think we covered a lot. No loans to start a site. Is it possible for doctors being foreign medical graduates to become CRA? Yes, all the time. Probably the best way is via study coordinator first. I know I can name like 5 people off the top of my head that have done that exact thing. West Valley Research Clinic. Yeah. So I think that's it. I'm going to end it, but thank you guys for the questions every Monday, Wednesday, and Friday. Don't know what time. Oh, and I almost forgot. At 8:30, I have to teach.
Yeah.
I'm teaching, guys, I might live stream this. I might live stream this on Instagram. So, yeah. So 8:30 p.m. Pacific time, which is 3 hours from now. I'm teaching via Zoom, a university in Mumbai about research. It's gonna be like Q&A, but also like practical aspects of running a site. And I'm gonna put on Instagram, and then on my computer I'm gonna record it. So I'm not gonna be able to go on LinkedIn, Facebook, and YouTube, but it will be on those things, but just not live. Maybe the weekend. I don't know. We have to edit the vlog of Office Space. So come on back.
Love your work, bro. We will catch up soon.
Yeah, how to?
Clinical.
Maybe not this weekend, but let's see what other times, because I think we have some stuff to do.
Gabby says live.
Yeah, I'm going live on Instagram at 8:30 Pacific time tonight. I think it's gonna be 11:30 Miami time. So it's gonna be late. Thanks, you and your team are awesome. Somebody said clinical research doesn't pay much. This is true when you start out. This is completely false once you have 2 years of experience.
Yeah.
And it's one of the best paying industries once you get that experience, whether you go the employee route or whether you go the business owner route. I mean, obviously, then it's even better. So, all right, Instagram. I'm gonna be back 8:30 Pacific to do. I almost forgot. I'm teaching. Imagine if I would have forgot to teach in India. Okay, we're gonna go live on Zoom for university students in India. So make sure that you guys come back at 8:30 Pacific time, 11:30 p.m. And we'll LinkedIn, YouTube, Facebook. Thank you guys very much. And we'll catch y'all later. Bye-bye.